Hello students, we will discuss today an instrument that's again commonly used especially in gynecology or laparotomies. That is, what is this instrument? See that here curve is there and fenestra is there and opposing tooth is there, and of course notch, and lock and handles here, handle and finger bows. So what is this instrument? It is lens tissue holding, very stout instrument, grip is very good. So it is used to hold tough structures in fenestral incision, the sheath, and sometimes olden it is to hold the lymph node during the lymph node biopsy, and some softer tissues when you want to hold. But it is traumatic, remember. Tough structures only should be held. You can't use it to hold the bowel, the delicate tissues, muscles or soft structures. So only to tough structures. Some uses to hold the lymph node, but it's not currently used, but it is mentioned in the books. But mainly tough structures like aponeurosis, remember. So that is lens tissue holding forceps. You can go through my clinical methods in surgery and my manual of surgery in detail about abdomen, laparotomy and other things. And operative procedure shows this instrument and other things in detail, all techniques, all procedures in detail with the 2 volume. You can go through my DigiNow and purchase that for a year to have a clear idea about entire surgery for UGC, ABM syllabus and basic for the postgraduates. I hope you understood this lens tissue holding forceps with the toothed, curved fenestra in the tip, which is mainly to hold the tough structures which has got a very good grip. So students, I hope you understood this one very well. Thank you very much.